Hello there. Pharmacology is the science of how drugs interact with living things. It's about what happens when a chemical enters our bodies and how it affects our cells, tissues, and organs. It's not just memorizing medicines. It's understanding the relationship between drugs and the body. When you take a painkiller, how does it know where to go? How does it stop pain? That's pharmacology in action. This field bridges chemistry, biology, and medicine, guiding the safe and effective use of drugs. Pharmacology is essential for pharmacists, doctors, nurses, anyone who uses medicines. It's the foundation for safe, rational treatment and patient care. Welcome to Pharmacology, a fascinating journey that starts with two core ideas. To understand pharmacology, you need its two main branches, pharmacodynamics and pharmacokinetics. Pharmacodynamics is what the drug does to the body, its effects, and how it works. Pharmacokinetics is what the body does to the drug, how it's absorbed, distributed, metabolized, and excreted. Think of it as a conversation. Pharmacodynamics is the drug's message. Pharmacokinetics is the body's reply. For example, aspirin reduces fever, pharmacodynamics, but your body also breaks it down and eliminates it, pharmacokinetics. Both are crucial. A drug can have a great effect, but if your body removes it too quickly, it won't work. Remember D for dynamics, what the drug does. K for kinetics, what your kidneys and body do. Mastering both is key to using medicines safely and effectively. These concepts are the backbone of pharmacology. Let's look closer at each. Pharmacodynamics is all about how drugs produce effects. Most drugs work by binding to specific proteins called receptors, like a key fitting a lock. Agonists activate receptors, triggering a response. Morphine, for example, blocks pain by activating opioid receptors. Antagonists block receptors, preventing other substances from activating them. We measure drug effects with a dose-response curve. As the dose increases, so does the effect, up to a point. Potency is how much drug is needed for an effect. Efficacy is the maximum effect a drug can produce. A drug can be potent, works at low doses, but have low efficacy, limited effect, or vice versa. Choosing the right drug means balancing potency and efficacy for the best outcome. Understanding these basics helps you predict how drugs will work in real life. That's the heart of pharmacodynamics. Now, let's follow a drug's journey. Pharmacokinetics, or ADME. Absorption, distribution, metabolism, excretion. Absorption, how the drug enters the bloodstream. Swallowed tablets are absorbed in the gut. Injections go straight to the blood. Distribution, the drug travels through the blood to its target organs. Some drugs stay in the blood. Others collect in tissues like fat or muscle. Metabolism, the liver breaks down drugs, often making them easier to remove. This process can affect how drugs interact. Some compete for the same liver enzymes. Excretion, the kidneys filter out drugs and their byproducts in urine. Some drugs leave via bile, sweat, or breath. The balance of these steps determines how long a drug works and how often it should be taken. For example, paracetamol is absorbed in the gut, distributed to the brain, metabolized in the liver, and excreted by the kidneys. Understanding ADME helps you choose the right dose and timing for each patient. It's the practical side of making medicines work. That's pharmacokinetics in action. With so many drugs, how do we keep track? We classify them. Drugs can be grouped by the body system they affect, like cardiovascular or respiratory drugs, or by what they do. Analgesics for pain, antibiotics for infections, antihypertensives for blood pressure. Some are grouped by chemical structure, penicillins or benzodiazepines, for example. Classification helps us choose the right drug for each patient and guides new drug development. Why does this matter? Because pharmacology is the foundation of medication safety. Every prescription, every dose, every patient interaction relies on these principles. Understanding drugs transforms you into a true guardian of health. Embrace pharmacology. It's your most powerful tool.